Welcome to the summer session of It's Your Health, the fastest 30 minutes in television land. I'm here with the hostess with the mostest, my bride, and we're going to hopefully entertain and inform you over the next 30 minutes. Make sure you check with your healthcare provider before doing any of the things we talk about here on It's Your Health. Right, sweetheart?
He's right.
That's the last time you'll hear that one. We'll be right back after this brief commercial message. You're watching It's Your Health, your leader in healthcare information. Welcome back to the first segment of It's Your Health.
I would like to say that you accused me on our last show that I wouldn't stick with my exercise program up at the Wellness Center.
I don't remember any of this, but
you did, and I want you to know that I have been with it for 3 months already.
Right.
And it's really a good program, and it's a nice, clean facility, and everybody's friendly. And by the way, if you see me, please stop and say hello. A number of people do that.
And make sure you wipe everything off before you leave the equipment
Absolutely.
area.
You always have to do that.
Okay.
Everybody knows that.
Just checking.
What does that have to do with it? Nothing.
Well, I thought I'd just mention that.
Well, you're supposed to tell me what a good job I'm doing.
It is impressive. You did get hooked on this.
A little bit.
Very good.
Okay. Now we'll get busy and get serious. Can you do that?
No, I
I
cannot.
don't think so. Can the chemical soup we live in cause cancer? A groundbreaking new report suggests scientists should be looking at how low doses of chemicals considered safe on their own might cause cancer when mixed together. They say that we're swimming in a chemical soup.
Well, there's no doubt. We used to get things in glass, which was pretty inert. Now everything's in plastic. There's concern about transmission of some of these organic compounds from the plastic into the food. You know, we're cooking in aluminum, Teflon.
What should we be cooking in?
I would prefer glass, to be honest with you. And, you know, the air is not as...
Well, when I cook, I always use glass.
Now, come on,
I
sweetheart.
use Vision's cookware, and so that's very safe.
Listen, sweetheart, we're doing a program on facts, okay, not fiction. So in either event, we do. The air is dirtier, the water's dirtier. So I think you really should consider doing something or taking something that would reduce these free radicals that can cause cancer. And one of the things that I do is I take fish oils because those are anti-inflammatories. I'm not saying they're going to lower your cancer risk, but they do make you feel better.
I take them too.
Yep.
And we gave them to our dogs at one time.
Oh yeah, that helped them too.
Yes, it did. The next headline, frequent sauna use associated with the reduced risk of CV-related all-cause mortality in men. In other words, if you use the sauna, the more often that you use it, the lower your mortality rate is going to be. I was surprised. I didn't think a sauna was anything other than, you know, somewhere to go when you're exercising and
sweat. Mm-hmm. Yeah, it is interesting. It lowers cardiovascular death rates. And one of the thoughts is that if you're sitting there, your heart rate is going faster. So you're kind of exercising, if you will, or exercising your heart while sitting there in the heat.
It's kind of almost doing meditation.
Yes. Yeah.
I see. And the reduced risk for sudden cardiac death was much improved for people who went to the sauna, especially more times a week.
Yeah, so that's kind of a surprise healthcare benefit, so start the sauna. What's wrong, sweetheart, now?
FDA panel endorses women's libido pill. The female Viagra pill, called flibanserin, I think, which is designed to boost a lack of sexual desire in premenopausal women. But members of the FDA are concerned because it causes fainting, nausea, dizziness, sleepiness, and low blood pressure. But that should make it all worth it.
Did you see those new bottle of pills I put on your counter? Well, of course, everyone's been waiting for the female, at least I've been waiting for the female Viagra pill. So here it is.
And you'll have to wait till the end of the summer. It hasn't been officially approved yet.
Right, so we're still waiting.
Uh-huh. So you're anxious for this, huh?
I'm going to put it in the sauce and pizza and spaghetti, so we'll see if it works.
Okay. What is early onset Alzheimer's? You forget things. It's not just the occasional name or date or misplaced keys, but people and events that have been part of the fabric of your life. Some people are diagnosed before the age of 65 and need to plan for big changes ahead. The early onset form most often shows up when you're in your 40s and 50s. Tell us about this and how will we get diagnosed and what should we do? And this is scary.
It is scary, particularly if there's a family history or you've had head trauma or other medical illnesses. It's very sobering to see a 50 or 60-year-old in a nursing home who you took care of and they don't know you anymore. But the key is to get early diagnosed and treated. And a lot of the times the forgetfulness is really not an Alzheimer's dementing illness. It could just be some memory impairment. You could be depressed. You might be having a vitamin deficiency. So it is a little sobering. We're seeing more and more patients with earlier and more severe dementias. So stay tuned.
Well, right along with that is our next bit of information, again about Alzheimer's. Your plate may hold the key to Alzheimer's. Healthy eating can help you stay at an ideal weight and stave off diabetes and heart disease. Now there's more evidence that a heart-healthy diet is also a brain-healthy diet and may prevent dementia or slow Alzheimer's disease.
Right. The Mediterranean diet is probably the best brain diet out there. Leafy vegetables, fruits, greens.
Fish, poultry.
Right. Staying away from the saturated fats, the processed foods, the sugars, the things along those lines.
Salt.
The things I feed you. That's the
diet.
brain
That's the stuff I shouldn't have, huh?
Oh, yes.
How do they work?
Well, the thought is that it's going to cut down on this myelin formation or blockage of the arteries. I think, a healthy diet, a healthy heart is going to fit and dovetail with a healthy brain.
Well, that makes sense.
I thought so.
He's so modest. That's one of the things that I just love about him. Gut feelings, more than heartburn and indigestion? Bacteria that live in the gut influence brain development, mood, and behavior. Doctors may, in the future, treat mood disorders with probiotics or prebiotics, and I have no idea what probiotics and prebiotics are.
Yeah, well, it's basically yogurt. They did some studies and they found out that people who live the healthiest and the longest are fermented food eaters, of which yogurt is one of those. And it sets up good bacteria. The good bacteria are going to help you not only in your mind, but your personality, your mood, as well as perhaps extend your life and prevent disease. I think that's the next revolutionary thing. Is before we always thought bacteria in the antibiotic age, the bacteria were bad, but in point of fact now it's turned around. The bacteria are the good guys, and we have to keep that in mind. So speaking of good guys, we're going to be taking a good break to see our commercial messages, and we'll be right back with the second segment of It's Your Health.
But I'm doing a good job cooking because I'm certain that there's plenty of bacteria in there.
We'll be right back after this brief commercial message.
Welcome to the second section of It's Your Health. And I'm not going to go through the whole thing that my husband does because you already know how good it is to watch the show. And people tell me all the time how much they learn. But I have to take a minute and commend you because this year you remembered our anniversary. And I was so pleasantly surprised that you remembered until I got a call from one of your patients who happens to have the same wedding anniversary as we do.
Oh,
And
well.
he told me that he called you and reminded you that it was your anniversary.
Yes, I know. Well, maybe we could elaborate on the success of 20 plus years of marriage. You really want to know what the secret is? I found this out many years ago while mowing the grass, that this is the key to a successful marriage with my wife. So, so what'd you say?
Not funny.
There you
That's
go.
what I said.
Listen, the best $5 you'll ever get, I'm telling you. It'll save you.
Oh, it won't save you when we get home, that's for sure.
Well, maybe with that woman's Viagra pill, we'll see.
You are really stuck on that. I'm going to do headlines instead.
Sounds like a plan.
Okay. Again, we go back to issues that affect the brain. Recurrent depression may take a toll on the brain. The area of the brain involved in forming new memories, known as the hippocampus, is that right? Yes. Seems to shrink in people with recurring depression. It's important to spot and treat depression when it first develops. Recurring depression takes a toll on the anatomy of your brain.
Yep, no doubt. And keep in mind that when you have depression, that it is actually a chemical imbalance. A neurotransmitter in our brain, serotonin, is imbalanced. And the similar analogy to that is if you had diabetes and your pancreas is not making enough insulin, or you have insulin resistance, the sugar goes up. It's a chemical imbalance and you feel poorly, and that leads to bad healthcare outcomes. And in the same vein, if you have a clinical depression, you do have these serotonin imbalances that should be corrected. And if not, they lend itself to brain damage that can be seen. So.
Do you think that people are more open to saying that they're depressed than years ago? Years ago, there was a stigma, I think, to saying that you were depressed or you were suffering from depression.
I think no doubt people are a little more open. Women particularly will sort of bear themselves. Guys are tougher. You know, they'd rather maybe hang out in a bar and do abusive behaviors. That's sometimes the way they deal with their emotions.
Not a very good way.
No, it certainly doesn't help. It creates more issues. But nevertheless, I think it's out there. And what's more important is the treatment is out there. In the olden days, we didn't have anything that would correct serotonin stuff. It just didn't exist. It's not in my old medical books. And the treatments for anxiety and depression, sometimes the treatments were worse than the disease, but not so today.
So those books that you were talking about that you found while you were cleaning the basement, sure you were. Are you going to get rid of those books?
Yeah, probably. They're.
That's one of the jobs that we're doing, is getting rid of stuff in the basement.
Let me get this thing back here. Do I need this again?
No.
All right.
Next headline. Could a vitamin play a role in acne outbreaks? High levels of vitamin B12 may affect germ activity in certain people, boosting the odds that they'll develop acne.
Well, you know, everybody's taking vitamins these days, and the only thing that vitamins are doing is feeding the fish, because if you don't need them, particularly the bees, you're going to pee them out. But this particular study says that there may be a bad aspect, particularly to vitamin B12, in it that can cause more bacterial outbreaks on the skin. But keep in mind that particularly in the elderly, B12 deficiencies are very common, and we would need to diagnose and treat those, usually with a blood test.
Well, it states here that too little vitamin B is as big a problem. It's implicated in anemia, digestive problems, neurological problems, numbness, tingling, vision, and memory loss.
Right, right. Well, one of the reasons for a reversible dementia is B12 deficiencies. So, and we see a lot of these because people are on these proton pump inhibitors for their stomach, for heartburn, and they can sometimes interfere with vitamin metabolism in your stomach.
You have a lot to teach us, don't you?
A font.
A font of knowledge. Oh, that's for sure. Antidepressants and fracture risk in menopausal women. I knew we'd get to it sooner or later. Women prescribed a common class of antidepressants to ease menopausal symptoms may face a long-term rise in their risk for bone fracture. The antidepressants in question are selective serotonin reuptake inhibitors, whew, that's a big word, medications such as Celexa, Paxil, Prozac, and Zoloft. Explain that.
Right. Well, for every reward, there's a penalty. We talked about depressive symptoms earlier. These are serotonin-mediating drugs. They actually have a very safe side effect profile. And there is more here than meets the eye. And I think the take-home message is, first of all, our population is aging. They are on medications that can accelerate bone loss. Not only the serotonin drugs have been implicated, but so have the proton pump inhibitors for stomach. The Prilosec, the Nexiums, and all those can lead to increased fracture risk. Here's the bottom line. Get a DEXA scan. Get a DEXA scan. Your insurance generally pays for it, especially if you've had some loss of height, which if you're honest, you may have had.
Maybe.
And if you have osteoporosis, there's excellent ways of treating this besides calcium and vitamin D. Once you've lost that bone, I cannot get it back. So when you get your mammogram, girls, make sure you get your DEXA scan. You're allowed one every 2 years, and that will.
Oh, I didn't know that. I did have one, but it was a while ago.
Right.
Which leads us right on to the next topic, which is developing osteoporosis. Women are 4 times as likely as men to develop osteoporosis. While you think it might happen in your later years, it can happen anytime. It means porous bones. It causes at least 1 fracture in as many as half of women older than age 50.
Yep, we see it.
Half of women.
And again, this is something that can be screened for, can be treated. Besides vitamin D, exercise is going to be your biggest thing to keep you from getting bad and soft bones. But there's actually some excellent medications. We like Prolia a lot. It's an injectable twice a year.
I take that.
So it's really good, low side effect profile.
We also want to make sure of our calcium and our vitamin D level.
That's correct. Correct. Thank you.
Thank you. You said it was correct. I appreciate that.
Be right back after this brief commercial message. I told you it's the fastest half hour in television history. Oh, you want to borrow those? You can.
I'll buy a couple pair.
We'll be right back. Welcome back to the last segment of It's Your Health. I'm with my bride, and I told you it's going fast. Fast and
It's
furious.
fun. You're having a great time.
Yes, I am. I'm having a great time. I keep telling myself, after 20 years, I pinch myself. I'm having a great time.
It's more than 20 years.
You see how great a time it is?
All right.
Moving right ahead.
Enough of that. I told him I want to have a big party on our 25th wedding anniversary. His answer was, does he have to come? Keeping fit, I'm keeping fit, may have seniors' heart failure risk. In other words, may cut it in half. The fittest seniors are half as likely as others to suffer from heart failure. And the failure risk includes not smoking, moderate physical activity, and a healthy weight. A person aged 55 has a 1 in 3 chance of developing heart failure in their lifetime. Wow.
Yeah, it is up there, and it's increasing. Of course, once the heart fails, it's difficult to get it back into its regular strength. And so one of the key things is exercise. Keep in mind that the heart's a muscle. And just like you exercise your arms and your legs when you exercise, aerobic or huff and puff type of exercises are the ones that will keep you heart healthy. We generally don't like the things that make you close your mouth and grunt, like weightlifting, for example. It's the huff and puff, walking, aerobic exercises that will keep your heart healthy and keep you out of heart failure.
And makes you sweat.
Yes, makes you sweat.
Okay, I got so distracted listening to you that I forgot where I was.
That's what happens when you sweat, sweetheart. You get distracted.
A healthy body equals a healthy brain. We've already talked about this. Eating right and exercising and maintaining your health can play into the graceful aging of your brain. We hear it again.
You know what, though? I'm kind of a little bit of a contrarian on this
No.
regard. Yes, I am.
I'm shocked.
You know, we are here for a visit, and I'm not so sure we have to dot the I and cross the T and do this and do that. 5 or 10 years from now, they're going to say, no, that was wrong. You have to do that and this. And, you know, I really think everything in moderation.
Everything.
Everything in moderation.
Every single thing.
That's.
I'll just take this and
I mean,
rip it
really,
right up. You know.
we're eat, drink, and be merry, and be in moderation. We're just here for a visit. Do you know how many patients I've treated over the years who jog, watch their weight, watch their cholesterol, do all the great stuff, didn't go for a cancer screen, and end up with, God forbid, colon cancer, and they're no longer with us. I mean, they did all those things that they were supposed to do, and you know, life is sort of a crapshoot, if you will. So sometimes bad things happen, and I think to some degree you have to live life and live it in moderation. But you need to live.
Let me take that a step further. Sometimes you also need to take some time off work. Sometimes you need to spend some social time, some active time, some time with your family.
It worked before.
You only want to do what you want to do, huh?
Well, you know, work defines us, and maybe that's the other side of the coin. I happen to like my work because I happen to like my work.
I know you do.
It rewards me.
I know it does.
People say
They
thank
give
you.
you pats on the back.
Yeah, I get stuff at work I don't get at home.
That's not true. I say thank you all the time
Do you
at
really?
home.
Okay.
Yes, I do, and you know that.
Okay.
Oh boy, he's really picking on me today.
Not
No
so.
good reason. This is an interesting one. Can orange juice and grapefruit raise your melanoma risk? People who enjoy a glass of orange juice or some fresh grapefruit in the morning may face a slightly increased risk of melanoma, the least common but most deadly form of skin cancer.
Yeah, well, when you're on medication, we generally don't like you taking grapefruit juice or grapefruit products at all.
Why is that?
Well, there's a chemical in there that competes with the degradation of the medications. This is kind of a sidebar to what you were referring
Okay.
to here. So if you're on medication, you should stay away from grapefruit and grapefruit products. It interferes with drug metabolism, big time, big time. The orange juice is not so much of an issue, but for what you described right now, the orange juice and the citrus family can have chemicals in it that can become what are called photosensitizers. And these medications make ultraviolet light burn the skin and make the skin more sensitive, photosensitizers.
Wow.
So it's kind of an unusual side effect of trying to stay healthy.
It reminds me of when all the kids go and play soccer, everybody brings bunches of oranges for them to eat.
Yep.
Maybe they shouldn't be eating the oranges in the sunlight.
Well, you know, it's one of those things again. For every reward, there's a penalty.
Okay, remember that.
I'm going to remember that.
Just remember that. Consumer Reports recommends 15 sunscreens. Nearly a third of sunscreens tested by Consumer Reports fell short of the promised SPF protection, missing the mark by anywhere from 16 to 70%. The only one that earned a full 100% score is La Roche-Posay Thelios 60 melt-in sunscreen milk. It's $7.20 an ounce.
Well, we're going to list the top 10
Sure, why not?
sunscreens. You got to use them. Make sure you use them, because if you don't, they're of no value. You have to use them often. And it's an interesting side effect, again, of medications is we're seeing more and more vitamin D deficiencies because we're telling people to avoid the sun and use sunscreens. And of course, you need the sun to have vitamin D work in your body. So that's just an added issue.
And when you look at the top 10, one of the top ones is called No Ad. And it's only 63 cents an ounce. And it got one of the highest ratings from Consumer Reports.
Wow.
I believe we have that in our
I do have
medicine
that.
cabinet.
I use it as a shaving cream, I think.
And they're not for natural sunscreens because they don't believe that they have in them what we really need. So make sure you put it on a half an hour before you go out and reapply it every 90 minutes and be generous with it.
Yep. Be generous, sweetheart.
You should be generous.
Okay.
Oops.
Speaking of oops, there it is. Isn't that a song? Oop, oops,
There it is, yeah.
Another 30 minutes goes by watching your favorite healthcare provider information network, Samsung Productions.
Well, that was a mouthful.
Remember, you're watching It's Your Health, your leader in healthcare provider information, whatever that means.
Thank you for joining us and being with us. And if you see me at the Wellness Center, stop by and say hello.
And we'll say goodbye. Thank you for joining us.